Welcome to Take the Lead Radio with Dr. Diane Hamilton, where she interviews some of the most successful leaders, entrepreneurs, authors, speakers, and other individuals who will inspire you to take the lead in your career and personal life. And now, here is Dr. Diane Hamilton.
I am here with Joost de Blok, who is the creator of the pioneering Dutch healthcare system, Buurtzorg. De Blok has developed a transformational model of collaborative, patient-centric community care. By empowering nurses in self-organized teams, he's turned traditional healthcare models inside out. With collaboration key to his model, de Blok has uncovered new ways of working and new areas of care at home and internationally. And he's now active in 25 countries with this organization he's created. This is really fascinating. So it's so nice to have you here, Joost.
Thank you. Yeah, nice to be there.
Well, I was very interested. I didn't get a chance to talk to you. We recently shared a table at Thinkers 50 in London, and I had a few people tell me, you got to talk to this guy. He's doing amazing things. So thank you for being on the show.
Thank you.
I'm very interested in what you're doing, and I'm a little confused just based on the United States, how we do things with nursing and doctors and who's in control and who's not in control, because every time I watched a video about what you've done, it's talking about the nursing aspect, but I haven't seen a lot talking about where the doctors are involved in all this. So I want to get into that part too, because United States, there's a lot of that involvement. But tell a little bit about your background, because you are a nurse originally. Yeah. And I love your story of how you created this company. So why don't you give a little background and tell me what led to your interest in creating your company?
Yeah. Yes. Before I became a nurse, I studied economics. So I should have become economist or something like that. Mm-hmm. But I got depressed during my study. And I quit my study and I became a nurse. I worked for almost 15 years as a nurse, most of the time as a community health nurse. And I liked this a lot because it was a lot of freedom in my daily work, a lot of autonomy. I could make the decisions myself, working with good colleagues. But after that in Holland, the system changed. Community nursing almost disappeared. It became home care. And they asked me to become manager director in the home care organization. I did it because I thought perhaps I can transform the organization and again go back to the principles of community nursing in the 80s. But it was very difficult because the system changed more and more towards a very production-driven way of organizing. And I wanted to go back to the professional ethics of nurses. So with some friends in 2005, 2006, I designed a model which I thought would be very sustainable for the future, based on network thinking and based on support with software we were going to develop ourselves. An organization without management. So the idea was that we could grow very fast and scale up based on a very organic way of developing organizations. I was inspired by Prahalat and Hamel. And my idea was if we develop something what shows that the quality increases and the costs go down, and a lot of nurses want to do it, then we can't fail. So that was my assumption. So we had a slogan, better care for lower cost, and we called it the natural alternative, because I thought we moved away from natural ways of organizing. So we started in 2000, at the end of 2006, one team of nurses. I got contracts with health insurers. I was part of this team and started to work again as a nurse. And at the same time, we developed in several parts in the country new teams. Usually teams heard about it, asked me, can we start a team in our region? And I already started a non-profit foundation where all the nurses could be hired, and which was the vehicle for this growth of the company. So in 2007 we started with 10 teams all over the country. All the time the same things happened. The nurses started their own network. They got the patients, they got the referrals from the doctors, from the hospitals, and within a few months they were break even and they were profitable. This way we were certain at 2007 that we could grow easily to a few thousand nurses. So that's what we did. So in 10 years time we grew to 10,000 nurses all over the country. We also started with new services. So in total now we have 15,000 nurses and care workers working in self-organized teams. We have around 1,500 teams all over the country. We have only 50 people at the back office, and we don't have a management structure. So this is the way we are organized, and this is the way we developed without any marketing. So that we got a lot of free publicity. From the start, we got a lot of attention from newspapers, television programs, and so on, because everything what we were doing was not logic in the system we were working.
Uh-huh.
So that's what we did, and we got many prizes on the most fast growing company, the best employer, the Future of Work award, the Albert Medal, and a few weeks ago we got the Thinkers 50 award, where we were sitting on the table together for ideas into practice, putting ideas into practice.
Well, that's quite a story, and I loved your TED Talk. Was it in Geneva? I watched that where you talked about how this all came to fruition. I have some questions just because of I worked 15 years in pharmaceutical sales for AstraZeneca, as you know, and things are a little different in the United States of how we look at who controls things and what nurses' roles are, what doctors' roles are, and so on. I'm curious where the doctors are in all of this. I mean, how in nursing, in terms of, are you prescribing? I mean, who's prescribing medications? Who's doing that part of the whole nursing aspect? Is this just taking care of people who are, released from care from the hospital? What kind of nursing are you doing here? And are medications involved, I guess, is my question.
Yeah. Yes, I think it's important to look at the context of Holland. We'll have a long history of primary healthcare. So we have GPs. Every person in Holland have their own GP, and every GP has around 2,300 patients. So our idea was that we could connect very easily locally with our teams, with the GPs who are working in these neighborhoods. So the doctors are prescribing medication, but usually when they have a good relationship with the nurses, they ask for advice for the nurses. So they say, for example, with wound materials, the nurses are taking care for the wounds, and then they advise the GP, and the GP prescribes the medication. So, but also the nurses have their own autonomy in deciding on how much care they can deliver with what kind of patient. So we have a system in Holland that all the community care is paid by the health insurers, and 100% of the people in Holland are insured. So, and I think that's different than in many other countries. So everything, we have contracts with the health insurance. So everything what we are doing is paid for by the health insurance, and the nurses themselves, that's regulated by law. The nurses themselves can just visit the patient, and they can decide based on an assessment. They can decide on how much care, how much nursing care does somebody need, and when the assessment is done right, then we can just bill all the hours care delivered, and we take care for different kind of patients. So everything you can imagine, what needs support at home. So people who have dementia, people with who are discharged from hospitals, people with chronic diseases, people who are terminally ill and want to die at home. So the idea was, if we have a team with high educated nurses, generalists, who are able to take care for all kinds of interventions, and if we include as many as possible activities needed in the service, then it's very attractive for nurses to work this way. So you can build a good relationship with your patient. The patient is very happy that she's only confronted with a few nurses. So and the system we had before in 2006, before we started, was very product driven. So we had many products, and all the different products were delivered by different people. So we said, we put all the products together, and we just deliver one service for one price. So we said to the health insurers, this service is at the end, by combining it this way, much more effective, and at the end also much cheaper per client per year than what we have now. So our idea was, by organizing it this way, by integrating the different services in one service, we said we can do it for 30 or 40% less cost than what's happening now. And that's also what we showed in time. So we did several researches, and we showed that these researches were done by KPMG and Ernst & Young, and it showed that we have 30 to 40% less costs than the average home care organization in Holland.
Well, that's really interesting. I'm getting an all-inclusive kind of thought of what you pay for in all you can eat or a cruise situation, instead of bit piecing everything together as a separate line item. And as you said that, it made me think of how hospice runs here somehow. I mean, the nurses are really the main people who come to the houses and deal with a lot of people who are dying in their last, months in the United States. I'm sure you're very familiar with what we do with hospice, which is a great organization here. I'm curious, just from working in pharmaceuticals, how challenging everything is to red tape, to get on your pharmaceuticals on formularies, to get people to approve anything, to have everybody's suing everybody's got all these issues. Who's got the insurance coverage so you don't get lawsuits? Is it the doctor? Is it the nurse? Who's dealing with all that there?
Nobody.
Nobody's suing anybody?
No.
Wow, that's a little different.
Nobody. We are taking care for 100,000 patients a year, mm-hmm. And we never, up till now, in all those 30 years, we were never sued. So in total, I think it's getting towards 800,000 or something. So, but suing, it's not something what happens a lot in Holland. So I think that's special for the US and for other countries perhaps.
Yeah.
But, the idea was, but the chance that you get sued by doing something wrong is minimal. So, mm-hmm. And that comes because the responsibility of the nurses, the ownership of their daily work, and the way they perceive it leads to the best possible outcome. So what we see is that what we say is usually when patients are satisfied about the relationship they have with their nurses, the results the nurse care, but also the satisfaction rates will be very high. So from the start, we had the highest satisfaction rates of the country. So it's 9.3 out of 10. When you build on trust and you build a good trustful relationship with your patients, the chance that you get complaints or even get sued is minimal. Mm-hmm. So already is that because of the distrust in the system, there were so many complaints. So when everybody's asking themselves how can I get as much as possible out of it, like a provider or a patient, then the chance for a conflict is quite high. So we said we have to build on professional ethics and we have to build on trust. And then when you build on trust, then you get another relationship than when you build on the interest of the organization or whatever. So we see that there is a very high satisfaction rates with the patients, and then a very high engagement with the nurses. And these two things, they are the main reason that everything goes very smoothly, and conflicts are solved in a very early stage.
Yeah.
So, and that's part of the way I think our values work out.
Well, and you're getting cream of the crop nurses, right? You're getting the top end, because I mean, my sister's a nurse recruiter, so she finds nurses jobs here in the US. And not all the nurses she has to find, they're not always super like excited about what they're doing. And do you find that you have a better work ethic in Holland? Because I've got some people in mind that I'm thinking, I don't know, maybe they need management to some extent because they're not super self-motivated. Or do you have that scale, or is just every nurse in Holland excellent?
The starting point, in my opinion, should be everybody is motivated. Not only nurses. Nurses, I think, have a more or less a vocation and are intrinsic motivated to do the best possible thing. What I think is that usually the circumstances they are working in, or they used to work in, are very frustrating, and that leads to a behavior that they are disengaged, but as a result of the conditions they are working in. So if you create conditions which asks for this accountability and asks for this responsibility and this ownership, then they will behave like that. So I think that usually this mindset about how do you perceive people and how do you perceive nurses, that's one of the problems. So that leads to control, and that leads to that we create conditions that they get frustrated. So if you turn it around, if you say, okay, we will listen to them and we will create the best possible environment to work in, then people will be happy because they can live their profession in the most ultimate way.
You know, it's really interesting because it ties into my work and curiosity of what I've found, of what makes people more successful. Because curiosity, if you're allowing people to explore what they're really interested in doing, then they're going to be more engaged, they're going to be more motivated, they're going to be more driven. It's all going to lead to better innovation, better productivity. You talked about perception. That's the other thing I write about is perception. And so you've tied into everything I'm interested in terms of how we can make the workplace better. I think a lot of people are misaligned in their jobs of what they really could be good at. And I think that if you could explore normal curiosity and let people ask questions and go about things in a way that makes them more comfortable, that you can really get the best out of people. So that's exactly what I'm hearing from you, right? So are you how are you getting these people to explore their curiosity? Is it just by taking the reins off of them and letting them have more control? Is that the key?
I think normally in life, I think in your private life, you want to arrange everything yourself. I hope you don't ask your husband to manage you and to manage your life of the family.
He wouldn't dare.
So, no. And that's what I mean. And I think that's very logic.
Uh-huh.
And my opinion is that that women are much better in organizing than men.
Uh-huh.
So and what you see in a lot of organizations is that you see more men in management than women. And these men who are very bad in organizing are telling women what to do. So I think that's bad, that's bad for everybody.
Uh-huh.
So in my opinion, management is a disturbance for people. So if everybody can use their skills they have in how to organize your daily work, your daily practice, and you work in a team where you honor your colleagues, you like your colleagues, and you want to work together, then everything is growing. So the relationships are growing, the personal skills are growing, and everybody is coaching each other in a positive way. So, but all the control mechanisms, which you see in a lot of organizations, are disturbing this process because they are based. Control, in my opinion, is based on distrust. So if you say we don't need these control mechanisms, my perception is that people want to do the best possible thing, but they want to regulate it themselves. So they don't want to be led or they don't want to be regulated by others.
And I think that people who are in jobs that they really enjoy and who really feel like what they're doing is meaningful and all that, definitely, I totally see that. I'm also, though, thinking of a lot of people I've worked with who think they're in jobs that they enjoy, but they like to take advantage of the system a little bit. And if you give them a salary and nobody ever looks in on them, they'll just keep taking that salary and do nothing. And how do you avoid that in other industries? I mean, in healthcare, I mean, somebody's sitting there waiting, they're sick, and if you don't show up, people really know it. You know what I mean? There's some other industries that maybe aren't so much that way. It's something I see a lot of. I mean, I've taught thousands of business courses. I've worked in all kinds of industries, and from top organizations to tiny, small companies. I've seen. Maybe it's a U.S. thing, but there's a lot of lazy people out there who really don't want to do anything but take a paycheck. How do you avoid that?
I don't believe that.
You don't believe it?
No.
I think that I'm with you 100% of I don't like to be managed. I want to work on my own. That's why I've taken the jobs I've taken. Yeah, because I'm super self-motivated and I only pick jobs that interest me. But I have to admit, I really wasn't thrilled about being a pharmaceutical rep. And when I was doing that job, I was way less motivated to work. And I think we need to be aligned to do it. Now you can't keep me away from my job because I love it so much. I think the key is to make sure people are really aligned to what they do. And you talk about how we can make companies be less managed. I think you talk about it as self-organization and agility and things like that. What are the things that companies who want to do this, maybe outside of healthcare, but this model could go outside of healthcare, right? What you're talking about.
I've been with a lot of other companies in the other industries, in banks, software companies, even with pharmaceutical companies. Mm-hmm. So I've been in many different industries. And every time again, I ask the question when I come to these boards, and people say, "How do you do it?" And then say, "It's not so difficult. It's I think starting with the intrinsic motivation of people, and starting with the idea what is the real service you deliver. So what do you want? How do you want to connect with the environment, with society? What's your purpose?" And then, when you reflect, there's reflection in the board of the organization about, okay, who do we really want to be? What's our purpose in society? Then you got the real questions. So then you got, so I think we really have to rethink how we structure our organizations. So a lot of things what I see happening creates this what you call lazy people, because in my opinion, of course there are exceptions, but these exceptions are very clear. So when something happens in our teams, which is not right or something, the colleagues see it immediately. So they talk about it. So, for example, a safe culture and safe environment, it's much more important than an environment where everybody feels pressed by productivity numbers. So the idea about what are the most important principles in an organization, which leads to happy people, to people who feel responsible, is safety, is wholeness, is a learning environment where you can develop yourself, is support from your colleagues. So these things are much more important than strategies on HR, strategies on finance, on IT, and so on. So, but we build these organizations with all these MBA minds, and this leads to a big frustration. And frustration leads to negative behavior, and negative behavior leads to disengagement and so on. So we, in our thinking about how to manage people or how to organize organizations, my opinion is that we start usually on the wrong end. And when the mindset is that people need to be led, then you will do different things than when you say, no, you can trust people based on their intrinsic motivation.
What about people who just really aren't competent at what they do? Who's going to help them get better if there's not somebody leading
The colleagues.
them? Who's that?
Their colleagues.
Colleagues. So it's a peer kind of situation.
Yeah. First, to prevent people to not be competent, or to get people who are not competent, it's very wise that the nurses are interviewing their own colleagues. Mm-hmm. So we said we give the teams have all the freedom to find their own colleagues. So they take care for the way they find their colleagues. So, and usually, if you are responsible yourself for finding your own colleagues, you will try to find the best ones. So, and every team is very careful in who they hire. So, and they are very strict in what they ask from them. So they are competent. If they, in the first period, if they see that they don't have the competences they thought, then they say, okay, how can we support you? And after a while, if they still don't have this competence, then say, okay, perhaps this is not the place for you to work at. So this is what's happening all the time in all those places. So the moment you're going to manage this, it goes wrong. So then you take away the responsibility and ownership.
Now, what's the incentive for the nurse to pick somebody for their team if they're not really working together? They're not taking care of the same patient, or are they? I mean, I'm
more or less.
What's their incentive to find somebody else to work with them?
Now, usually the teams are growing from the start, so they need colleagues because they have a lot of patients who want to be supported by these teams. Mm-hmm. So the moment you feel that you need a colleague, you're going to try to find a colleague. They are working together, so they see each other a lot. So you can see it as a social structure.
Okay.
These people see each other several times a week, and they discuss the patients. And usually when patients need several moments a day support, then it's usually done by a few nurses who are working together. So these teams are very supportive social networks.
Yeah.
So the idea is that they find their colleagues, they include their colleagues, they guide them, and they learn them how the principles work. Usually it's very logic for everybody.
Mhm.
So in a few weeks, you know what's expected from you. And you feel that you're usually one of the things people are saying when they started to work for us is that it feels like we just landed in a warm bath.
Mhm.
So that
That's
it
nice.
feels
Mhm.
like you are rewarded, you are cared for, you are supported, and you can ask anything you want to everybody. So you are part of a community. It's
Mhm.
part. And it's not only in the team, because all the teams are also connected with our IT system. So you can ask your questions on the platform, which looks like Facebook, and you say, okay, I have trouble with this. Can anybody advise me on it? And you get 20, 30 answers. So that's what's happening all the time.
I'm curious, do you ever have any conflict? Like, say, Joost likes to hire Diane, but then Bill doesn't like Diane. The other nurse finds
Yeah.
that your choice is not really would have been his choice. Then what?
Now, all the choices are made based on consensus.
Okay.
So we have, so in the teams, we have introduced the method from the start, which is called the solution-driven interaction method. So we say every decision should be made based on consensus. So it's the example you mentioned is not possible. So if a few nurses in a team say we shouldn't do it, this new colleague, then the decision is no. So we don't do it.
And if somebody's on and becomes a problem, then it has to be consensus to get this person removed as well?
Yeah.
Okay. Well, how did this fly when I'm looking at some of the places you went to the US, you went to Japan, Sweden, China, Czech Republic, Belgium. I was looking at some on your TEDx talk that you gave. You listed some places that you've been talking about that. How'd that fly in the United States? What issues did you run into here?
When we started in Minnesota, in Stillwater, it was the result of our connection with the University of Minnesota. We are working together based on the Omaha system. That comes from the US. That's what we implemented in Holland.
Mm-hmm.
But there were a group of nurses who said, we want to start an experiment here in the US. So I said, okay, let's find out if it's possible. So I learned about Medicare and Medicaid and how it works, and they had a connection with the doctors in that region. But what was very different, I think, than what we found out in Holland was that most nurses want to work full time.
Yeah.
Because they need a salary. And in Holland, most nurses work part-time.
How many hours is part-time usually?
The average is 20 to 24 hours.
Okay.
So, and what I learned in the US was that the need for earning money from the start was I think gave a lot of tension with the results of this small company. So this freedom, when I saw in Holland everybody felt responsible for the results, it was different in the US.
Yeah.
So everybody felt responsible for their own income, but the way they dealt with the result of the team was quite different. So the moment we discussed it, it changed. And at a certain moment we were break even and things were going well, but we couldn't find enough nurses in that region who wanted to work this way. So they thought it was asking a lot of responsibility. And so we didn't really build a very good example like we did in many other countries. So in a lot of other countries, we could show by building good examples that it was not so difficult to do, and that the good examples inspired other nurses to do so. So in Sweden, for example, in Japan, in Germany, We have now a development that more and more nurses come over, start to work this way, and feel the the positive parts of it. So at the end, I think 1.5 years ago, we had to close down our small company in Minnesota.
You know, the U.S., we just do so many things so differently. It had to be
Yeah.
quite a different reality to come here. There's a much more competitive feeling and the corporate feeling. I mean, everybody's working really hard. I was wondering how this would fly here, and I wondered what you do with leaders, managers in your setup that, you know, who were already there. Then what's their job?
Yeah, they don't have a job anymore.
Yeah, okay, so they could either become a nurse or do something else.
Yeah, no, we transformed several organizations towards our model, and in these organizations, which has been a process for 2 or 3 years, the people who had been managers before, they start to think about what could my role be in the new environment. Some of them become coach instead of manager, but some of them don't have the skills for coaching, and some of them just start to look outside the organization. So what we found is that when the motivation for change is very clear, and also you can explain it to everybody, because what we said, it increases quality and it reduces cost. So how can you be against it? Is it more or less sometimes what I hear. And then, you know, when you show people and also you support them in finding something different, another job, then everything goes very smoothly. So when you only see it as a kind of cost reduction or changing the structure, then you get difficulties. So you have to have a very conscious process. So you have to listen to everybody, what the concerns are. You have to communicate a lot with everybody about, okay, what kind of solutions can we find for the people we don't need anymore? And step by step, you will find solutions.
So with the complicated coding systems, I know we have it horribly complicated coding system for everything we offer here in the US. And I assume yours was not great there before you made all these changes as well. You had to deal with a lot of codes, right? Has this changed that? And in what way?
Yeah, we changed it completely. So we had a very complicated coding system too. So we had an assessment institute that was deciding on what care people could have, what kind of products, how much hours, what the prices were of this product. But based on my experience in healthcare, I've been working for almost 40 years in healthcare. Mm-hmm. I said, we are going to just put all these products together. So we can provide, if the health insurers want to have a list of products, we will provide them this list of products and the time spent on this product, but it will not be the reality. So the IT system, we made an IT system which was able to give the health insurers the list as they wanted them. At the same time, we started a discussion with the health insurers. It would be much easier if we just have one service. Then we simplify everything, and we have a very simple coding system, and we have to look at the results of what we're doing. So we said, if we know more about the outcome, mm-hmm. we know what kind of interventions are good practices, and how can we improve the results on the quality side, but also on the cost side. So, and the first one who really adopted the idea was the Minister of Health. So she visited us, and she talked with the nurses, and then she said, "How can I help you?" So I said, "Perhaps if you make it an experiment in Holland, and we can grow, and we can show how it works, then perhaps also others can learn from it. So she made it an experiment. She said, okay, you can you get the opportunity to just have one prize, and if it works out well, then we will make it a policy, and we will make a law which allows nurses to decide on what they. So that took 5 years, and after 5 years, the Ministry of Health changed the law. The government changed the law. We changed the regulations. So everything what we are doing now is normal in Holland. So and we saw it as a transition. So we thought it take 5 to 10 years to change the healthcare system this way. So it is also my assumption in other countries that it needs somebody who is able to deal with the system and to build something practical in a practical way. So that's what I did all the time. I worked together with the ministry, I worked together with the health insurance, I worked together with the inspection and so on. So, and by seeing it as a kind of transition, we changed this part of our healthcare system.
Do you still have formularies, or did you ever have formularies for medications and that type of thing like we do here?
No, we as I said, we started to use the OMAHA system, which is a classification system of problems, interventions, and outcome. We integrated it in our IT system. So we started our own IT company with building all the software, and we integrated it. So everybody's working with iPads or Chromebooks. We don't use paper anymore. So, and everything is integrated in our file, the way we make our care plans. And we are working together with universities to use the data to show what kind of patterns we see with what kind of patients. But now we try to use as less as possible protocols and as less as possible forms for.
Well, what about, I guess in the United States, with formularies, we are lists that like medications that are allowed to be used in a hospital or from a doctor. Say we have HMOs and those types of things here. So if a doctor wants to prescribe a drug, if it's not on that list, he can't write it because he's associated with that HMO or that hospital or whatever, and they haven't put it on their formulary. Do you guys do that kind of thing there?
Yes, but as I said, the prescription of medications is done by the GPs.
Right.
It's a natural regulated thing.
Right.
So the pharmacist and the GP regulate the medicine, and we provide. So we. So
you ever get frustrated? You want to give a medication that is available somewhere but not from your doctor? I mean, no. I was, because that's something we deal with here, and it's really interesting to see the differences in healthcare from each industry. From each country. And I'm curious. I've always been in sales, and so I have this naturally competitive, wanting to get to the next level kind of thing. Now, if you're a nurse, you just, in this situation, you always are a nurse. There's no climbing the ladder anymore because there's no ladder, right? You stay where you are. Is there any problem with people who want to just kind of go to the next level, do something bigger and better? Does it keep you in one thing forever where you're maybe you would like to expand and go somewhere?
No, but I don't believe that the next level is better, as you say it. So I think what I see is a decrease of integrity. If you climb up in the organization, you see more political behavior. You see more things that I think a lot of people are not proud of. If you would do these things in your private life, you would have a lot of conflicts with your family. So I think what I try to focus on is how can you develop yourself as a person. So how can you develop your talents? For example, if you are very good at taking care of people with dementia, how can you have more education on that? If you want to work with people who are terminally ill, how can you focus on that? So you can see the traditional, the way you in an organization traditionally grow in jobs. In my opinion, is a big mistake that it's improving you.
Mm-hmm.
So what I see is that growing as a person in your daily work by doing more complicated things is more fruitful, gives you more meaningful feelings than growing in a management job.
I see.
But I see it's one of the struggles with a lot of managers is that they don't feel that they don't feel they're doing meaningful things.
Yeah.
So they're frustrated. What?
We're in meetings all day, right? Just meetings.
The terrible meetings.
Uh-huh.
When I've been manager for 10 years.
Uh-huh.
And I was amazed. I was director of innovations. And every time again, when I was in these meetings, I thought, how is it possible that these really intelligent people are talking all the time about things they don't really understand, make decisions about things which I think, are they right, are they wrong? Yeah. And they're talking all the time about things that I didn't really like. So I used to, when I had this meeting for a day sometimes, strategic meetings, very important, then I had always this more or less starting point that I said some intelligent things that everybody thought, oh, he really has thought about this topic. And then my role was done, and the rest of the day I was just dreaming about how the world could look like if we do it in a different way. So I really, if your mindset is that you want to build a career on hierarchies, that it creates side effects which are not very healthy and is creating a lot of disturbance for others. So I believe much more in how can we create environments where people can develop themselves as a person and personal qualities.
What about the financial aspect of developing, instead of hierarchy in terms of job, hierarchy in terms of money making potential? Is there any, do you like any kind of commission-based things, or is it all like, are they everybody's set at a salary and that's where you stay, or how does that work?
No, it's the salaries are based on in Holland the union agreement, and it's based on experience and education. And what we see is that we don't have discussions about salaries. So we said we want everybody to feel that the way they are paid is reasonable. So they should be happy with the way they're paid. So that's also one of the things that people think I did very happy with their salaries. What we have a part which is working with care workers, and what we saw was we had a kind of a takeover from an organization who got bankrupt. There were 2,400 people, care workers, who were really.
Mm-hmm. You're saying care workers?
Care workers who are doing domestic care. Mm-hmm. So, and it's a different part. It's called buurdiensten. Mm-hmm. There are 4,000 people working, also in self-organized teams. When they came in the organization, we raised the salaries. So they got bankrupt in the organization before. We raised salaries. I was 2 days ago, we had a big conference with these people, and I was telling them that because of the good financial results, for the first time we could offer them a bonus. So they got an extra payment next month, and it's based on, so the same people they're taking care for, the organization before they get bankrupt, and now we have a very good financial result by raising the salaries, and we can give them a bonus now.
That's awesome.
So that's what intrinsic motivation does. Just by letting them take the decisions themselves. finding out what are the best ways to deal with their clients, and trying to be as good as possible with their team, so that the productivity, without discussing the productivity has increased.
Do
The
you
sickness
rate
rates.
people? Do you rate people? I mean, do you have customer satisfaction surveys or people rating them like a Uber get 5-star kind of thing? I mean, is there any of that going on?
Yes, we have a different ways of. We have a national system where people can give reviews, so everybody can see it. So if you go to what they call Zorgkaart Nederland, if you go to this website, you can see all the providers in Holland and the reviews of the patients. So, and you can see, if you look at buurtzorg, you can see it's a 9.3 is the average. And all over the country, wherever we are, it's between 9 or 9.5. So that's, but it's never, nowhere it's lower than 9.
If you get somebody who has a low rating, how does that dealt with?
We don't have it.
Yeah, just not at all. Doesn't happen.
It doesn't happen.
Plan in case it happens.
No, but that's you're. I can imagine. I can imagine, right? Because I this is the way of thinking. Yeah, I think that if your mindset is more focusing on how can we let the good things grow. So I got a lot of questions always from the UK and always from the US, which are always on what if. Always these questions, and I said, why should you spend time and energy on things which are not going to happen? So why shouldn't you spend time on how can you increase the quality? How can you increase the conditions for people to work in? How can you focus more on education? How can you create learning environments? That's much more interesting.
So do you feel like there should be proactive thinking at all in terms of what could happen in the future, foresight thinking or not?
There are 15,000 people every day thinking how they can improve what they're doing. So because of the ownership, they are using their minds, their brains, also with their families. It's also funny. When they have positive feelings about what they're doing, they're talking at home in a positive way about what they're doing. Then they get reflections from the families. And for example, when they have a partner or a husband who is an IT person, he gets involved. So he says, perhaps you should try this or that. Oh yeah, I'm going to bring it to my work. And so what we create is not only within the organization a community, but there are also small communities everywhere. So and even the patients, they feel they are part of these communities. So there are learning places all over by creating these networks. So if you have this hierarchy, and if you think you have to control people and you have to do this and you have to do this will never happen. Right. But if you let it grow bottom up and just respect the differences in how people are dealing with things and respect how they're learning, it's amazing what happens.
Were you frustrated at all dealing with the US way of thinking, just being different from the way you're used to people thinking? Is it much more competitive or cynical, or, you know what I mean, than what you're used to?
No, I think I never become cynical.
Not you, but that we are, that you would find us cynical or find us
that you are.
Be frustrated by us.
No, I think that I understand how it works in an environment like the US. I would like to I would love to be there for a while to show that things can be different. And I think there are a lot of people who would be very motivated to do the same things. So
Do
So
people
for
feel
me,
threatened though that they're going to lose their job here more than other places? I mean, is that
no,
no?
no. That's when I think I was several times. I was just 5, 6 weeks ago. I was in San Francisco, and you see, there is always kind of people who are in front of others in development. So I think there are a lot of people in the US who understand that this way of thinking is coming. It's always there. Young people, for example, young people. If you look at the millennials, most of these young people think this way.
Yeah,
They don't want these hierarchies. They don't want
we're seeing
complicated.
a lot more in the younger
Yeah.
generation. I totally agree with you.
So the coming generations will change the way we organize. So it's just a matter of time.
Yeah.
And what we did in Holland was very disruptive. We are now disrupting mental care in Holland. So we have psychiatrists, psychologists, psychiatric nurses who are treating people at home. So they said they should move out from all these institutions, and we should treat their environment too, because that's a real sustainable solution. And it's growing very fast. Psychiatrists want to work this way. So I think that this self-organizing principles, I see them. I was in San Francisco with Google and Apple and all these bigger companies who are also struggling with their hierarchic way of working.
Yeah.
So how can we keep people motivated? Disengagement is a big problem.
Huge.
So, and I think if the starting point is how can we engage people, and how can we create environments where people want to work, then engagement is not a problem anymore. So in Buurtzorg, engagement is, we have 92% of people feel engaged.
Wow.
And if you see the Gallup research, it's 18%. Yeah. So I think we are in a kind of change of eras. So we need to find other ways to deal with problems in society, and we have to rethink the way we organize, I think.
Well, healthcare is ripe for changing, as is education here in the United States. So it's going to be interesting to see what happens. I serve on a board at All for Life, which is an app to connect healthcare people all together into one way, so people can share and connect, like what you're talking about. And that was started by Heiko Schmidt, and it's just a really impressive way of making sure everybody shares the best of what they know, and people get all-inclusive access to everything. And I think that we're seeing more people coming up with ideas like that here. But I could see that the U.S. has a different way of doing things than Holland obviously does in some respects. And so I'll be curious to see if you come back and try another state. California would probably be tough. Kaiser and all the big names there would be kind of hard to disrupt, but I could see starting again in the Midwest somewhere.
I had a lot of meetings with Kaiser.
Oh, did you? Yeah.
Yes. But their own structure is one of the problems.
Yeah, there's a lot of.
But no, I talked even with some senators in Washington, and there is a lot of interest. But we say we are working now with 25 countries. We're working in Asia with China, with Japan, Taiwan, Korea, India, and we want to work with people who really want to do this. So we have partners everywhere, and these partners know the system they're working in. So we need people who really want to change the system and who also are able to do it. So sometimes they're entrepreneurs. So we have, for example, Germany, we have a great person who is able to deal with the system problems. So we have meetings with health insurers. We had meetings with the ministry. But he's also an entrepreneur and can develop these teams in a very inspirational way, very pragmatic. And what we see is that it's growing. And we have a very ambitious plan for Germany. So we said, okay, within a few years, we want that. And everywhere it's seen in Germany. We have been on television in all the newspapers in Germany. So, and this is part of this transition. So, and you need only a few small examples to show what the impact can be if it becomes bigger. And it's so, but it's important. So, whenever somebody comes from the US and says, "Okay, we see a lot of opportunities here, and we want to do it," then we will be there.
Well, you're doing some amazing things around the world, and everybody at Thinkers 50, we're just talking, you know, you were the talk of the town of what you've done, because it's such a unique company and you've had such success. And it was really exciting to have a chance to talk to you about it, because I know we didn't get a chance to talk much there because it was such a busy event. Mm-hmm. So thank you so much for agreeing to be on the show. And I think if anybody wants to find out more, how could they find out more or contact you?
Oh, they can look at Buurtzorg International, and they will find the website. And they're very happy. We get a lot of visitors from all over the world. And we organize inspirational days. And the commercial part, which organizes all the consultancy activities. So, but by just looking at Buurtzorg International, they will find the way how to connect. Okay?
Jos, this was so great. Thank you so much for being on the show. And this was really
You're welcome.
And
it was a pleasure.
Oh,
okay.
Thanks. We will be back right after this message.